Wondering what specialty trainees get paid in Australia? Well, wonder no more and watch this video. Hello YouTube, I'm the Career Doctor. I help you manage your medical career right here on YouTube, and today we're talking about the amount of money that specialty trainees, or what we call registrars in Australia, earn, the income, the salary, a lot of information. We're going to talk about the variation from state to territory and the variation in pay amounts. We're going to talk about specialty trainees in hospitals, and we're going to talk about general practice trainees as well. And we're going to look at the costs and wait through to the end because I've got a few quick tips about negotiating a salary to give you at the end, because it's actually not known that there are some things that you can negotiate around salary as a specialty trainee. Okay, let's look at the rates of pay for specialty trainees, or what we call registrars in Australia. The first point to bear in mind is that just like interns and residents, the rates are set independently in each state and territory. So we see quite a variation. So for example, in Western Australia, registrars start off being paid around $95,000 for a full-time annual salary, going up as high as almost $162,000. That's the best in the country. Whereas in Tasmania, there is the lowest rate of pay, a little under $90,000 per annum, going up to as high as almost $127,000 annually, again on a full-time basis. But there are a few tricks to be wary about here. For example, in the state of New South Wales, it's not unusual for a specialty trainee to not be paid as a registrar initially, and to be paid at what's called the senior RMO rate. So if we look at the $87,000 that you get for that in a place like Sydney, all of a sudden being paid $89,649 in Hobart looks a little bit better in comparison. So watch out for those tricks. Another key consideration is that most doctors don't just stop working at 40 hours a week. Often it's unavoidable to do things like overtime and on-call. So if we take the example of a surgical trainee in particular, many of these will work on rosters with low numbers where there might be one of 3 trainees. So that means being on overtime and on-call on a regular basis. If we look at, say, a 4-week roster for such a trainee, then they would do 160 normal hours, but then they might do a bunch of on-call from weeknight, as well as maybe working a weekend with 10 calls. And all of a sudden that 160 hours base work goes up to something like 360, maybe even more hours when you factor in the fact that you get paid time and a half and double time for most of the overtime that you actually end up working. So what about general practice? Because we haven't talked about general practice trainees because they don't work in the hospital system very much. So for GP trainees, the situation is a little bit different. Again, there's this thing called the minimum contract, which according to the General Practice Registrars Association, for your first year trainee is $75,000 per annum, and then in your third, and which is normally your final year of general practice training, goes up to $97,000 per annum. Again, bearing in mind that this is a minimum salary, possible to negotiate things like proportion of Medicare billings to go on top of this. But if we compare the two minimums of, say, a first year general practice trainee versus a first year registrar specialty trainee in New South Wales, there is about a $10,000 difference. However, if we factor in the fact that a first year general practice trainee is becoming a first year trainee usually in their postgraduate year 3, whereas many specialty trainees are waiting up to PGY6 or even further to commence working at that position, all of a sudden the difference in salary doesn't look that significant. The other thing that we also need to bear in mind is that the GP trainee may well finish and complete and become a specialist a lot earlier than the other specialty trainees, because general practice training takes a little less longer in time. There are many other things to take into account when considering which specialty trainees earn the most, but of course there are costs involved for all specialty trainees, including student debt, college fees, course fees that you might have to do as part of your training, examination fees, and in some cases you may have to buy your own equipment. So pre-existing student debt from medical school can be as much as $100,000, even more. College fees can vary quite widely, but usually start at around $2,000 and go up to $4,000 for a trainee. Course fees really depend, and you may not have to actually do a formal university or other type of course. Exam fees can again widely differ between $1,000 and up to $10,000, and it's unclear whether you might need to buy some equipment, but usually that's a few hundred, if not $1,000 as well. So the last thing I promised to talk about is negotiation of salary, and one thing that's actually not quite clear to a lot of specialty trainees is that it is possible to negotiate some of the work conditions that you're employed under. We've already highlighted that general practice trainees may be able to negotiate a proportion of their Medicare billings, and whilst you aren't, as a specialty trainee in a hospital, going to be able to negotiate things like extra pay above what someone at the same grade might get, there are a few things that are important to think about, particularly at the point where you're offered employment, because this is when you are in the biggest position of power. The employer has made a decision to appoint you to the role, and they want to close that deal. So this is the time where you might gently probe for some more information. Things that I would recommend you doing are making sure that you're being paid at the appropriate grade and year, particularly if you're going from one employer to another, because often they may try and start you at the base level for whatever a registrar is in their particular situation. So make sure they take into account the total amount of years of experience you've had, both as a specialty trainee as well as a doctor, because that can make a significant difference. Other things that you might want to lock down at this point in time is if there are specific rotations or leave periods that you might need for personal or training reasons, you might be able to get some confirmation in writing that these can be sorted out in your favour. And finally, if you're moving from one hospital to another, it's always worth inquiring about relocation expenses, because these aren't normally widely advertised. And whilst the employer may say, sorry, no, there are no additional opportunities to help you with the relocation process, it doesn't hurt to ask, and you may find that there is some additional support, because this is usually within the discretion of the employer, because it's not something that's actually prescribed under an award or enterprise agreement. Well, thanks again for watching. Did this make sense to you? Do you have a question? Did any of the information I presented, particularly around the overtime, seem real to you, or perhaps got it wrong? I would love to enter into a discussion. Also love to see you at our Medical Careers Workshop in Sydney on the 29th of June if you are a trainee in Australia and wanting some help with your specialty trainee application. There'll be some links to all that information in the description below, as well as a link to the blog post related to this post, and information about our community groups and courses. And I will see you in the next video.